Hello everyone, this is Dr. Rodriguez. If you have any questions, feel free to ask, okay? Hello, Daniel. Dan is asking, is there to get the surgery financed? Yes, the answer is yes. Please contact our coordinators and they will give you all the information, but yes, you can finance your surgery for sure. You're welcome, Daniel. Paula Ramos is asking, if you had a gastric sleeve, can you do a bypass? Yes. If you already have a gastric sleeve, we can do a gastric bypass, we can do duodenal switch, we can do mini gastric bypass, and the answer is yes. And probably the MRY gastric bypass is one of the best options. More if you have acid reflux, the MRY gastric bypass, the traditional bypass, could be the best option for you. Hello, Becky. See you soon. See you in November 17th. We're going to take good care of you, okay? Oh, Daniel, Sarita put a link when you can get info about the financing the surgery. You can find it in the comments. It's a question from Instagram. Will you perform my surgery in my liver if my liver is too large? Well, something important before surgery is to do a pre-op diet. If you do your diet correctly, we're gonna give you all the information to do a good diet. But the goal of the diet is to shrink the liver. But if you have a large liver, we can do the surgery, but it's going to be better if you do the diet. And if you found a small liver, it's going to be better for you and for the surgery. So we can handle that, but it's better if you do a good diet. So if you follow the nutritional instructions before surgery, your liver is going to be normal. So, but the answer is yes. Do you have a specialist to help me with the IV placement? Yes, all the nurse staff is expert doing IV. We have many patients. We have been doing this for a long time, so yes, we have an expert doing the IV placement, and everybody's experts doing bariatric. So yes. Do you have any tips on maintaining weight loss after surgery? The surgery, it's a tool. It's a big tool. But the most important part after surgery is the diet. If you change your habit of diet, you will not have problems with the weight regain and also with the weight loss. If you do diet and exercise, you're gonna control your weight after surgery. Chad is asking, do I need to shave my beard? It's gonna be better for the anesthesia. If you really like your beard, you can keep it, but it's gonna be better if you shave before surgery. How much weight can I expect to lose after gastric bypass? I weigh 279. Our goal is the BMI. We want you to go to normal BMI that is between 21 to 24. So I need to know your height to do the BMI calculate, but our goal in weight loss surgery is to go near to the normal BMI. Nicole Edwards, she's asking, hi there, you performed my surgery in September. I've been curious why I only have 3 incisions. I'm very grateful, but the rest of my group had 5 incisions. Well, sometimes we can do it with 3 incisions. It will depend on anatomy findings. If your liver is small, if your anatomy of the stomach is okay, we can do the surgery with 3 incisions. But it will depend on the anatomy during your surgery. Danielle is asking, will I will it be safe to do the surgery if you sinus tachycardia? Well, we need to do a EKG to understand how's your, if there is an arrhythmia or if there is something that is controlled. If the internal medicine says that we can proceed with the surgery, we can do it, but we need to check if your sinus tachycardia that is not an arrhythmia, if we can do the surgery. But the most important part is during before surgery internal medicine evaluation. But I believe we can do it. Do you know why you have sinus tachycardia, Daniel? Do you have a diagnosis? How can I take care of my incisions? We do small incisions because we do laparoscopic technique surgery. The biggest incision size is 1 inch, so you only need to clean it with water, clean water and soap. So there's no big deal with the incisions. Becky, I had my blood work in August. My iron was at 15. I have been on extra iron. What does it have to be okay with surgery? We need to see the complete blood work to understand what is going on with you, Becky. If you can send us a picture of the complete blood work, we can give you a better answer. But our goal is to have a hemoglobin higher than 12. How do patients normally feel after waking up from surgery? This is not a painful surgery, but you're gonna feel pressure in your chest, in your left shoulder, a little bit in your incisions, but the pressure pain is the most difficult part after surgery. How do you know when you are ready for plastics? Normally, we need to wait around 1 year after surgery, but when your BMI is around 28, you can start thinking in plastic surgery. Is constipation after bariatric surgery normal? Probably you can be two or 3 weeks. It's not constipation. But because the diet before and after surgery, you're not gonna be able to go to the bathroom probably 2 or 3 weeks. But it's not gonna be constipation. So you need to do a liquid diet after surgery, then soft diet, and probably after 2 or 3 weeks you're gonna be able to go to the bathroom. When will my new stomach heal completely? Normally, it's gonna be after 3 or 4 weeks after surgery. So there's the normal healing time. That's why we need to do a strict diet after the surgery to leave the healing time. Tiffany, she's asking what determines the removal of stomachs for BSG. Well, the size of the stomach is something really important, and we also use gastric calibration tube. So those things are the most important part. The size of your stomach, that is going to be a finding, and the gastric calibration tube that we normally use 36 bougie size. Can I have surgery while on my menstrual period? Does it matter if I have heavy bleeding? No, you can have surgery without a problem. Actually, it's really normal to have your period because the diet stimulates some hormones, and that's why it's really often to have the period during surgery. How long should I keep my bandage on? Probably 1 week. I am having bad breath after surgery. Is this normal? Can I know what kind of surgery do you have? and the surgery date. When can I try for pregnancy after surgery? We recommend 2 years after surgery, but some patients can have pregnancy 1 year after surgery, okay? But the recommendation is 2 years after surgery. What part of Mexico do you do surgery? Tijuana, Mexico. For the bad breath, gastric sleeve, and surgery done 3 months ago. Okay, sometimes with the weight loss surgery is also a metabolic surgery. And all the fat changes that you're having can have hormones, cycle changes. Sometimes that can explain the bad breathing. Something that we need to know, do you have pain? Do you have any issue after surgery? We need to understand more what is going on, because sometimes it is normal, but sometimes it could be an issue. Alex Clark, I have surgery with you on the... I'm waiting for you, Alex. Hello, Rina. You're welcome. Why do I need to stop smoking before surgery? Smoking can participate in the healing part of the stomach. If you smoke, you're not going to have a good healing tissue, so that's why it's really important to stop smoking. Also, you can have gastric ulcer if you smoke, so it's really important to stop smoking after surgery and stop and not to smoke anymore. How long after pelvic floor reconstruction to have sleep done safely? Probably 3 months after the pelvic floor reconstruction is it is a good time to do bariatric surgery. Doctor, hello Terry. What causes esophageal spasm and how can I be dealt with? The way you eat is gonna be the most important part. You need to do a small bite, chew really good. It's gonna improve the spasm. Can I know when was the kind of surgery I did? Also, the surgery date, please. Can my sleep apnea be improved with the weight loss? Sure, yes. The answer is yes. Probably after 6 months after surgery, you can leave your CPAP machine. Why is walking important after weight loss surgery? When we do laparoscopic surgery, we use a medical gas to inflate your abdominal cavity. We try to remove as much as we can, but probably the gas still there, around there 10 or 15% of the gas. That's why you have the gas pressure pain, and the only way to take out that gas is walking. What kind of surgery, Lisa? Well, we need to do a revision of all the parts of the gastric bypass. We need to redo the stomach part, the anastomosis, that is the junction between the stomach and the small bowel. And sometimes we need to go to the connection between the small bowel to the other part of the small bowel, and to make a longer malabsorption area, and that's why we said that we have to do a tune-up of the surgery, but we redo all the parts of the bypass. Somebody's asking, I am over 18 months post-op. How much calories should I get and how much protein? And I had a mini bypass. Well, it will depend of your size and your BMI. Calories calculation it needs to be calculated with your height and your weight goal, but probably should be go around 1,080 calories per day, but it will depend of your height. What is the Jennifer is asking, what is the minimum BMI to have gastric sleeve? The minimum is 30. I sent it earlier, let me check. Okay, sure, I was August 3 and I did the sleeve. I did send an email with the photo we took also asking about it. And the bite and swallow last month shows acid reflux, spasms, and a small hernia. Okay. You only have 2 months after surgery. I believe that right now the gastric sleeve is really stretched because of the time, and also the acid reflux can be the reason of the spasm. And also if you have a small hernia, that can explain the spasm. Yes, we can send you that info, Lisa. But also in our web page, you can have that information. Is in the part of the revisional surgery. You can have more info about that. But yes, we're gonna send you everything you need. How old do I need to be to have a gastric sleeve surgery? Okay, we can do surgery before 16 years old, but if you are under 18, you need to do endocrinologist and psychologist evaluation to accept you to have surgery, but we can start with 16 years old. Well, Daniel is saying, while I'm resting, AKG test be okay for my sinus tachycardia. Okay. BMI is okay, Daniel. Probably it is a reactive sinus tachycardia. I think you're going to be able to have surgery with that problem, but if you have a cardiologist to do a test, it's going to be better. Jennifer said, BMI is 31, but I'm trying to lose the weight to get off diabetic medication and hopefully reverse vital liver. My hemoglobin is under 7 as well, not bad. I still have to take medication and I can lose weight on my own. Jennifer, weight loss surgery can help you a lot, okay? Yes, Terry, I'm gonna send you medication you can use after this live, Facebook Live. I'm gonna give you all the information to help you to improve these spams, okay? But yes, we're gonna be able to control. I was told I will have to do the bypass to deal with these issues. The bypass is for patients that have acid reflux, but let's try medication and then we can. It's gonna be better if we start with medication. Can a patient sleep if the pouch stretch? Patients with previous gastric sleeve, the re-sleeve is not the best option. Probably we need to go to a different procedure, but we need to to understand more about the sleep, to see if you're able to have a good sleep. But it's gonna be better if you think in bypass or duodenal switch. ¿Cómo estamos? ¿Sí tenemos audiencia? Sí, ¿no?
Hay una pregunta de Mariah que dice, once we are home, what pain medication can we take? Pero está en
Well, painkillers after surgery. We're gonna give you all the painkillers that you will need, but we use traditional painkillers, non-steroids painkillers. But sometimes we can use narcotics. If the patient needs narcotics, we can use narcotics. But traditional painkillers is gonna be enough. We're gonna use it around 7 days or 10 days after surgery. But should I use an abdominal binder after surgery? It's not necessary. You can use it, but it's not a medical recommendation. But you can use it, okay? It's not necessary, but there's no problem if you use it. Can I use antidepressants or mood stabilizers after surgery? Yes. You're gonna be able to use it. If you already use, you're gonna restart medication 2 days after surgery. Hello, Jenny. I'm glad you're doing okay. God bless you too. How long do I have to stay in Mexico to get the balloon in? Just one night with us. If we place the balloon on Thursday, you're leaving on Friday. And for the balloon removal, it's only 1 day. What is the best lap band revision option? If you have acid reflux, the MRI gastric bypass is gonna be the best option. If you are a high BMI patient, the duodenal switch can be a better option. But the MRI gastric bypass should be the best answer for you if you have a lap band. How soon after the surgery will I start to see or feel a difference? You will see the difference in the first 3 weeks because after surgery, it is a strict diet. You're gonna lose a lot of weight. The first weeks, you will see a lot of change. The first month, I'm sorry. Will I have acid reflux after gastric sleeve? 15% of the patients when we do gastric sleeve can have acid reflux. Okay, we need to check if you have an hiatal hernia. If you have one, we're gonna fix it. We're going to fix it, and that will improve the acid reflux. But if you're thinking in a gastric sleeve, you must know that 10 or 15% of the patients can do acid reflux. Okay. Yes, Lisa says, I was supposed to be 2 days, but I had complications, so I stayed 2 weeks in hospital. Unfortunately, it doesn't happen for most people. All surgeries have risk. Uh, Risk in weight loss surgery is bleeding and leaks. And you must know that we do our best to prevent risk complications, but there's always a risk. When I do receive the medication, do I stop taking omeprazole? No, don't stop. Don't stop omeprazole. Please continue with omeprazole. We already got you, Terry. I'm going to give you all the medication you will need. Okay. Are the titanium staples dissolvable? No, the titanium is not dissolvable. They're going to stay there forever. Danielle is asking if I had a hernia and acid reflux, you fix the hernia? Yes, I'm gonna. If I found a hernia, I'm gonna fix it. Yes, there's always 10 or 50% to get acid reflux. Yes. Yes, and as Lisa says, all patients have different. If you have a chronic disease like a lupus and autoimmune and diabetes, the risks are higher. Mm, Kelly is asking, uh, I have had uh, hip replacement. Should I also take my 2 days of antibiotics before surgery? Yes. Yes, you need to take your antibiotics after surgery, before and after. What will cause a surgeon to choose to do a call during the gastric sleeve? We only remove the gallbladder when patients already know that have an issue like stones, and some patients, if they told us before surgery to remove the gallbladder, we're gonna do it. But it's it's not gonna be. We don't remove gallbladder if you don't tell us to remove it. Okay. He said, I have lost 100 pounds since my surgery. Congratulations. Is over 60 years old okay for surgery? Our oldest patient is 84 years old patient. We need to do a different pre-op to understand what is going on with the lungs, with the heart, but the age is not anymore contraindication of for surgery. Dice high loose. Ah, okay. Time is over, okay? It's been a pleasure to be here with you. See you next time. And if you have more questions, you can always send us the questions. Answer all the questions, okay? Bye-bye. Oh, yeah.